Let's move on to the next subject. We've got lung disease. My father died of lung cancer.
Oh, I'm sorry to hear that.
But he smoked 80 cigarettes a day.
Yeah.
And gave up only when he was 55.
Yeah, it's very sad. I mean, what we now know about smoking and lung disease is very clear. Professor Dole did the research on that, and interestingly, he did the research on doctors. If you there was a time doctors used to advertise smoking. I've been to countries. Yeah, they used to. The military used to encourage their soldiers to smoke. It used to be, freely given out to smokers.
Was that to calm them down?
To calm them down. So it's only really since the 60s that we've had the data that clearly links the smoking to the risk of lung cancer. Now, if you give up smoking before the age of 30, you can reduce your risk of lung cancer to almost back to the zero that it should have been. Obviously, there are other pollutants. One of the trends I think that's risky at the moment is this shisha trend, because in a shisha,
this is the smoking, the pipes. Okay.
You could be smoking the equivalent of 20 cigarettes in one shisha.
Really?
You could be. Yeah.
I thought sort of they sit out and
it bubbles through the water and all of that. No, but I think there's some evidence that the carcinogens, i.e. the cancer-producing agents, are still there, and you do have some risk.
Right. I gave up smoking 16 years ago.
Excellent.
Best thing I've ever done.
Well done.
Somebody's watching this show thinking, wowee, I'm a smoker, I'm coughing my lungs up every day. What's the easiest or the best way to give up smoking?
I think the simple answer is there's no definite easy way, and it may take you several attempts, but don't give up. Every attempt is worth doing. The NHS has fantastic schemes for smokers at the moment. Some of them involve mental therapies like hypnotherapy, some of them involve medication, things like Zyban, and some of them involve using other techniques to encourage you, nicotine patches and things like that. I think the thing for a smoker is to realise it's an addiction. Usually you're addicted to the nicotine component, and to just keep trying. Don't give up. Also try to change your social habits. A lot of people smoke with their booze. A lot of people need to use their hands, and to a lot of people it's perceived as quite cool to smoke. A lot of our advertising, a lot of our media, a lot of our film stars, a lot of the iconic shots are of them with a fag. So it's changing that culture and that mindset as well to make you realise there's nothing cool about coughing your lungs up or not being able to breathe at the age of 40.
And they're £10 a packet now, Dr. Charlie.
I didn't realise they were that cheap.
I think, yeah, exactly. So in terms of your lungs, I cough from time to time, but I go running on a Sunday. What are the telltale signs that I may be having trouble in that area?
The good news is that you run, and if you're able to run for more than 30 minutes without getting significantly out of breath, you're on a good track. If you couldn't walk 50 yards without getting short of breath, or if you couldn't walk up a flight of stairs on a regular basis without getting out of breath, then you've got a problem. I did a medevac once with a young man who, unfortunately, he couldn't even cope with the flight. He was due to go on a holiday. But when you go on a flight, you're at the equivalent of 7,000 feet, so there's less oxygen, and this poor guy needed oxygen on the flight. We had to bring him straight back. He didn't even get his holiday.
Really?
Yeah, it was that bad.
So basically, if somebody tests themselves, they could run at a reasonable pace for an hour on a track on a Sunday morning, you could say their lungs are in pretty good shape.
I think their lungs are in pretty good shape. The other thing to let people know, especially smokers, is that there are blood tests we can do now to assess their risk of future lung cancer. So that's a significant advance.
Wow. So you can predict potentially?
Yeah, it gives you a clue.
How big a clue?
A significant amount. It's all been validated, it's scientifically relevant, but it at least gives you the indicators that you are in the risk category. So if you then develop
But is that all down to your genes?
Well, we think it's a mixture. Certainly, smoking itself is the carcinogen, so anyone who oversmokes will expose themselves to that risk. Some people may have a genetic predisposition on top of that as well.
OK, so the final subject, I walk around the city of London absolutely for hours on end, and I'm breathing all of these fumes and smoking.
Yeah.
What am I better off just sitting in my studio and not doing that?
We have to admit it is a problem, and what we know is that kids who live near motorways do have problems. People in Beijing have significant problems, and so air pollution is a significant factor. Anything we can do to reduce it, to be greener, is important. If I was a cyclist around London on a regular basis, I probably would wear a decent filter mask.
Right. OK, but do you get cases of lung cancer being caused by people walking around the streets of London?
Well, in Beijing, they think point that one of the very young people who has lung cancer, they think it is from the air pollution in Beijing, which, by the way, is way worse than it is here.
Right, okay. Right, that wraps up this segment of the Tip TV Health Show. Thank you.